Hello, welcome to Respiratory Rounds. This is series one of a two-part series on sarcoidosis. We'll talk about definition of sarcoidosis, its epidemiology, pathogenesis, and various presentations. So, beginning with definition, sarcoidosis is a multi-system granulomatous disease of unknown cause. It forms non-caseating granulomas in affected organs. It is characterized by a CD4 Th1 biased immune response. It commonly involves respiratory system, but can also involve heart, brain, skin, and various other organs. The risk factors are non smokers are at a higher risk of developing sarcoidosis, a positive family history of sarcoidosis, and if the symptoms are amongst the two common organs which get involved in sarcoidosis, example, eyes and lungs, there's a higher chance that that could be sarcoidosis. Moving on to epidemiology, it is a global disease. It occurs worldwide, but its distribution can vary by region and ethnicity. It is more common in African Americans. It is rare in children and is usually found in the age group of 20 to 40 years of age. It is increasingly being recognized in adults who are more than 40, and it is more common in women with an incidence of 2 is to 1. In UK, the incidence of sarcoidosis is 1 per 10,000. It is more common in black population and leads to more aggressive disease characterized by involvement of skin, nervous system, bone marrow, and liver involvement. Looking at the pathogenesis, sarcoidosis is a disease of unknown etiology, but it is an abnormal immune response to usually benign antigens that can be infectious pathogens or environmental stimuli or some kind of occupational exposures. These antigens are then presented via HLA class 2. Due to the involvement of HLA class 2, there is a suggestion that there is a role for susceptibility of host rather than it just being derived due to an antigen and immune mediated response. It usually happens in genetically susceptible hosts. After the antigen has been presented, it leads to activation of CD4 T cells, which lead to Th1 immune response. And Th1 immune response leads to a cytokine cascade where the key cytokines are interleukin 2, 6, 17A, TNF alpha, which is very important in induction and maintenance of granulomas, interferon gamma, which is the main cytokine of Th1 immune response. The Th1 immune response and the cytokine cascade leads to formation of non-caseating granulomas. Among the genetic susceptibility, it has been proposed that individuals showing HLA-DRB1 they are associated with higher incidence of sarcoidosis. When we see a granuloma in a biopsy, the main differentials that should come to our mind are if it is a caseating granuloma, tuberculosis, non caseating granuloma, sarcoidosis. Other differentials can be hypersensitivity pneumonitis, granulomatosis with polyangiitis, which is also known as Wegener's. It can be a drug reaction. It can be non tubercular bacterial infection. Certain fungal infections like coccidiomycosis, blastomycosis, cryptococcosis can also form granulomas. There can be granuloma formation around foreign bodies. Looking at the various systems which can be involved in sarcoidosis, in pulmonary sarcoid, we usually get bilateral symmetrical hilar lymphadenopathy. There can be nodular opacities and fibrosis. In eyes, it can lead to uveitis, keratoconjunctivitis sicca, or dry eyes. In skin, it can lead to erythema nodosum, which is purplish, painful patches on the legs. This is usually inflammation of the subcutaneous fat and is associated with Lofgren syndrome. It can lead to lupus pernio, which is a sign of chronic disease. It is usually a bluish discoloration around nose and eyes, and usually happens in chronic sarcoidosis. In renal, it can lead to renal failure, obstructive uropathy, nephrolithiasis. In cardiac sarcoid, it can present with cardiac conduction defects, pericarditis, and heart failure. In musculoskeletal involvement, arthralgia is quite common. Arthritis is unusual with sarcoidosis. It can also present with proximal myopathy. In central nervous system, it can present with lower motor neuron facial palsies, optic nerve involvement, and mononeuritis multiplex. This is all for series 1. Stay tuned for series 2, where we will talk about different presentations in respiratory system, different syndromes in sarcoidosis, how to establish the diagnosis, and what is the latest in its management. Thank you for your time. Thank you for watching.